Namaste. On behalf of My Retired Life Association, we have some questions related to prostate cancer. So we have with us Dr. Salil Patkar, consultant oncologist, Apollo Hospital, Navi Mumbai. Welcome, sir.
Namaskar.
My first question is, sir, what are the common symptoms to prostate problems?
Okay, interesting question. So first thing, that whether it is prostate cancer असू or whether it is going to be a benign enlargement of the prostate, म्हणजे non-cancerous prostate. जसं age goes on increasing, the prostate goes on increasing in size, and both of them will present with the same symptoms. It is going to cause increased frequency of urination. म्हणजे the patient will have to go multiple times to relieve himself while passing urine. Nocturia, म्हणजे patient will get up multiple times in the night wanting to pass urine. So these are the two most common symptoms that you come across. Is you are going to have increased frequency, परत लघवीला जावं असं वाटतं, you will have to go for urination multiple times. You will feel that your bladder is not getting evacuated. Urinela जातो तेव्हा you will feel that while you have urinated, even though you feel like you are going to urinate more, but there will be no passage of urine. Another thing that is commonly observed when your prostate enlarges in size is that जी stream असते, urine ची जी stream असते, that becomes very thin. And it takes a lot of time to start urination. So many a times you will find your patient, ज्यांचा prostate enlarged, they will complain that they go and stand for urine and they have to wait at least for 1 and 2 minutes, or sometimes even longer, maybe 3-4 minutes before the urine starts. So that is a very common symptom that is observed. And once it starts, the stream is very thin. It's a very thin stream, so it takes much longer for them to completely evacuate their bladder. So in summary, increased frequency, you have to keep going more times to pass urine. Nocturia, you tend to go at night more often, you wake up at night wanting to pass urine. And third is decreased thinning of the urine stream. The stream of the urine becomes thinner and it takes a longer time to pass the urine. And fourth and last is that it takes a longer time for you to start passing urine. So you have to wait in the bathroom much longer before finally the urine stream starts. These are common symptoms observed with enlargement of the prostate. It could be a benign enlargement, which is non-cancerous enlargement, or it could be a cancerous enlargement. One of the red flag signs would be if you start passing blood in urine. It could signify either a urethra, a bladder, or it could signify a prostatic cancer, possibly. Of course, even in that you have things such as stones, which are more commonly responsible for hematuria, that is blood in urine. But these are the signs and symptoms.
How do we identify whether it is benign or malignant?
So how to know whether it is benign or malignant? So what is benign and what is malignant? कुठलीही गाठ or any growth is known as a tumor. Now, not every tumor is cancerous. So a tumor can either be a cancerous tumor or it can be non-cancerous. The other word for a non-cancerous tumor is benign. Benign tumor is something we don't have to worry about. The commonest example of a benign tumor is a Charbichi ghat or a lipoma, as it is called. So most of us have 1 or 2 lumps of fat in our body, which is known as a lipoma. That's an example of a benign tumor. So similarly, the prostate enlarged, like I said before also, as your age goes on increasing, your prostate enlarges in size. This is a normal phenomenon, which is known as benign prostatic hypertrophy. It is very commonly observed in our old age patients, as you might have noticed. So which is why majority of our old age patients always come with complaints that they have to wait for a lot of time before they start passing urine. This is because as your prostate enlarges, it compresses upon your urethra, which is that tube through which the urine passes. So benign enlargement of the prostate is a non-cancerous, almost a physiological enlargement of the prostate that takes place, and for which also there are treatment options available, including some drugs which help reduce the pressure on the urethra through which the urine comes out. So that is a benign enlargement. Now on the other hand, sometimes when the prostate increases in size, it is because of a cancerous involvement of the prostate. And as your age goes on increasing, one of the most common cancers to occur in the body in the senior population in males is a prostatic cancer. So in fact there is evidence that a large number of prostate cancers go undetected, and जेव्हा autopsy करतात, means when they try to find cause of death, for some other reason they find out, oh, the patient also had a prostatic cancer. So it's prostate cancer in old age is quite common, one of the commonest cancers to have in male population in older age, and not necessarily that all of them have to be treated. So that is the difference. So benign is a non-cancerous enlargement of the prostate, for which there is medication and maybe sometimes surgery also required. On the other hand, sometimes an enlargement of the prostate can be cancerous, for which the treatment differs completely.
Sir, what is the PSA and what does it signify?
Okay, great. So PSA is basically it is a marker. It is a sort of tumor marker. The prostatic surface antigen म्हणतो आपण त्याला. That is the full form of PSA. There are few markers in the body for every cancer. For example, say you take an ovarian cancer, there is a marker in the blood known as CA125. It's a blood marker. If you take certain types of testicular tumors, you have something known as AFP and alpha fetoprotein, or you have LDH, or you have beta HCG for testicular tumors. Now, these are basically hormones or proteins or some substances which are produced by that particular organ and only that particular organ. So, if that marker is increased in your body, it means that somewhere in that organ there is some abnormality taking place. It is growing at a faster rate, which is why this is happening. So, similarly, PSA or prostatic surface antigen is produced primarily only by the prostate. And because it is produced only by the prostate, if there is a growth or a tumor which is growing very rapidly, because it still contains prostate cells, the PSA starts increasing. So what the PSA is, it is a biomarker. It is a biological marker which can help tell us whether our patient is or may be having a prostatic abnormality which could or could not be cancerous. It can help us identify those patients who probably are going to be more likely to have cancer. For example, if your prostate is enlarged but your PSA is say less than 10, the chances are that you may not have cancer, although it should be evaluated. But if you have a PSA which is more than 10, your prostatic surface antigen values is more than 10, the chances that you have cancer become higher. So it definitely needs to be evaluated further.
How does one detect prostate cancer and what tests are need to be done?
Okay, so firstly, not everybody needs to be evaluated. Like I said, that as your age increases, one of the commonest cancers that you can develop is the prostate cancer. So first, who should be evaluated? If you have signs and symptoms, you should get yourself evaluated, especially if you are say beyond the age of 65, and if you have urinary complaints, if you have difficulty in passing urine, if you are getting up frequently at night because you have to pass urine, if you tend to have to wait longer before your urine stream starts, complaints that we have discussed priorly. If you have these complaints, yes, you must get yourself evaluated. Chances are that you don't have cancer. Chances are that you have a benign enlargement of the prostate, which is known as BPH or benign prostatic hypertrophy. But you have to evaluate it. So one of the first steps that you do is you get a USG done, a USG abdomen and pelvis. What this will do is it will tell you the size of your prostate. If your prostate is enlarged, then we need to do something about it. If on the USG the prostate is not enlarged, then probably the reason you are having these symptoms is something else. Perhaps it could be an uncontrolled diabetes, which can also cause an increased frequency of urination and nocturia. But let us assume that we do the first test, we do a sonography. In the sonography, we find that the prostate is enlarged. Then the second step would be to get a PSA done. If your PSA is increased, if your PSA is significantly increased, we definitely should evaluate it further. If your PSA is not increased, the chances that you have cancer are very low. If your PSA is borderline increase, the chances are that you have a benign prostatic hypertrophy, which means you don't have a cancerous increase in the prostate, it's a benign enlargement of the prostate. But if your sonography shows that your prostate is enlarged in size, and if your PSA is also increased, it suggests that you probably might have to be evaluated further to rule out that you have a prostatic cancer. In which case, the next step would be getting a prostatic biopsy done. And the second step would be getting an MRI pelvis done to see if you do have cancer, then how far has it spread. So the first step would be to get a sonography and a serum PSA levels. A good surgeon or a good clinician would do a per rectal examination at this point. Clinically also it is easy to differentiate at times between what is a benign or a cancerous growth. If you are used to doing a per rectal examination as a clinician, you can tell the difference between a cancerous and a non-cancerous growth on PR examination itself. But that again would be followed up by doing a PSA and a sonography. If after that we are still doubtful that there is cancer, then we would go ahead and do a biopsy and we would go ahead and do an MRI pelvis to stage the disease.
Sir, what are the various treatments for prostate enlargement, both benign or malignant, that is medicine, operations, chemotherapy, etc.?
Alright, great. So, first and foremost, I will talk about cancer because that is my specialty. So, we'll keep benign aside for some time. First, we'll deal with the malignant part. So, suppose you have a cancer, you are detected with a cancer of the prostate. Prostatic cancer is very different from other cancers. You know, if you have an ovarian cancer or a lung cancer or a stomach cancer, very, very rarely would you find your doctor telling you कि कुछ नहीं करते, आराम से बीमारी कंट्रोल में है, इसके लिए कोई दवा करने की जरूरत नहीं है. दैट विल नेवर हैपन इन अ लंग कैंसर और अ स्टमक कैंसर और अ colon cancer. But for a prostatic cancer, it is very important to realize that prostate, by inherently the nature of the disease is such that it does not usually grow aggressively. I have two patients in the age group of now 84, 85. Both patients, prostatic cancer, diagnosed, biopsy proven. I do not have them on any form of treatment because the disease is at a very low stage. It's not very aggressive, and there is a very good chance that they will both outlive the cancer and they will die of some other cause. They might die of a cardiac cause or maybe some other cause, but they would not die of prostatic cancer because it is growing at a very, very slow stage. So first and foremost, not every prostate cancer needs to be treated. That is very important to understand. Not every prostate cancer requires treatment, especially depends upon your age. If your age is 85 plus and if your prostate cancer is only in an early stage, maybe stage 1, there is no need for treatment because the prostate cancer will grow at such a slow stage, at such a slow rate, that probably you will not have any signs or symptoms or any major comorbidity or any major problem related to the prostatic cancer, and you will probably have more difficulty related to the treatment. But having said that, suppose your stage is the cancer is at a higher stage, then the treatment options include: one, going ahead with a surgery. If the patient is fit enough, you do a prostatectomy. If the patient is fit enough for a surgery, well and good. If the patient is not fit for surgery, maybe because of age, the other option includes going ahead with radiation to the prostate. If the disease has already spread, if it is a stage 4, then again I would like to remind everyone that prostate is a slow growing tumor. Even a stage 4 prostatic cancer grows very slowly. There are people who have disease which has spread to the bones who are alive for a decade and even more than 10 years, a stage 4 spread prostatic cancer, and they're still alive because it is usually a slow growing tumor. So even if it has spread, then the options include hormonal treatment. Now the prostate, like some other cancers such as the ovary and the breast cancers, are hormone dependent. The prostate cancer is very dependent upon a hormone called as testosterone. So if the disease is spread, if it is a stage 4 prostatic cancer which is spread to the bones, like I said, it is still not very bad news because it will still be very slow growing. But then we need to act. And the first thing we need to do in that case is we need to stop the source of the fuel which is promoting that growth of that tumor, and that is the hormone testosterone. So one of the first things that is done is either you do a bilateral orchidectomy, which means that you do a surgery for the testis so that the hormone testosterone production stops, and which by itself in many cases is more than enough to control the growth of the tumor and to cause it to regress. The other option is going for an injection. These are known as gonadal injections, GnRH. These injections suppress the testosterone hormone level and they control and even regress the prostatic cancer. So these are two options that exist. Beyond that, we can go ahead with, if the disease has spread beyond, if it is a stage 4 disease and we need to put the patient on some form of treatment, then there is hormonal and targeted therapy available. We don't necessarily have to do chemotherapy. There are absolutely easy to tolerate oral treatments such as abiraterone, bicalutamide, which are orally taken treatments with just 1 or 2 tablets a day, and they incredibly and beautifully control the prostatic cancer. So chemotherapy is not required for every patient. In fact, majority of my patients are on oral treatment, and I only put them on chemo if at all they progress on oral treatment and there is an indication. So most patients of prostatic cancer, even stage 4, can be managed on oral hormonal treatment.
So it is possible to prevent prostate enlargement?
So it is one of those things which I said that prostate enlargement, can you prevent? Well, the answer is probably you cannot prevent it, you can control the symptoms. Okay. Why can you not prevent prostate enlargement? Because like I said, it is one of those physiological things that happens as your age advances. Prostatic hypertrophy is not something that can be completely prevented. What you can do is you can reduce the symptoms associated with increase in the prostatic size. There are drugs available which open up the urethra, and so whatever symptoms you might be having related to the prostate, they can be definitely mitigated, they can be reduced. Is it possible to prevent prostatic enlargement or to prevent prostatic cancer? It is more debatable. There are some data which says that intake of beta carotenes and selenium and all have helped, but there is not enough data to suggest that. My advice would be that lifestyle modifications in general have prevented almost most cancers. They reduce the risk of almost all cancers by 20 to 25%, which includes prostate cancers, prostate, colorectal, breast, ovary, All of these cancers can be reduced by following a healthy lifestyle, which includes more of fruits and vegetables, cutting down on processed foods, absolutely not having alcohol and cigarette smoking, all of which have been associated with prostatic cancers. So, can you prevent prostate cancer? You can bring down your chances of prostatic cancer significantly by cutting down on all these, the tobacco, the alcohol, the smoking, processed food, and going for a healthy lifestyle. Having adequate fruits and vegetables, following a healthy exercise regimen, all of this has been shown to reduce prostatic cancers and cancer in general by nearly 20 to 25%. But can you decrease the chances of prostatic enlargement or prostatic hypertrophy? Probably no, it is a physiological thing. Some degree of prostatic hypertrophy occurs as you age, but there are wonderful tablets available to treat that without having to worry. So you can go for tablets such as Urimax, tablets such as finasteride, which just improves the urine outflow, and you don't have to worry about the prostatic hypertrophy in that case.
Thank you, sir. Thank you very much.
Thank you so much. Thank you.
Sir.